Hello, and welcome to another episode of the CIRS Group podcast. I am Barbara.
And I'm JC.
Today, we are very excited to cover the research portion of CIRSx. We're continuing our series of the CIRSx conference recapping. And today's talks that we will be talking about is the one that Dr. Ritchie Shoemaker, the man, the myth, the legend himself did, as well as very good friend to the podcast, Dr. Christian Navarro-Torres, his talk that he did with the amazing Dr. Peg DiTulio. And they talked about MSH. That'll be fun. And also, we'll save this one for last. Ming Dooley did a fantastic summary, more than a summary, I should say, of all of the research that has been done around CIRS, actually, over 20 years of research. Incredible. We'll get to that later.
But before we get into any of those talks, just a quick reminder, we are not medical professionals. We've read the CIRS textbook. We go to mold conferences. We're just pro mold information, but that doesn't mean we're medical information. So make sure you talk to a provider if you're looking at changing anything up for yourself. And with no more ado, much ado about nothing, much ado about nothing, we're going to jump right into the talks.
It is that kind of day. Awesome. I'm excited for all of this. So yeah, first up is Dr. Shoemaker himself. Very emotional moment. We did cover this in our initial more emotionally based CIRSx recap video. But we very happily all gave him, I think, multiple standing ovations, really. And yeah, that was a powerful moment to be able to applaud the man in person who is responsible for all of us finding this path to healing. That was amazing.
Yeah, it was an incredible experience, and I'm so glad we got to be a part of it. His talk was very technical. There was a lot of technical information. His talk was what makes a CIRS provider. And so he went through a lot of technical information, which he read the CIRS textbook if you want the technical information. But for me, my biggest impression from the talk was it was him saying goodbye. It was him passing the baton on to the next generation of providers. And that was kind of confirmed for me by one of the providers there. I said, it sounded like a goodbye. And he replied with, yeah, Dr. Shoemaker, like, he just doesn't like traveling anymore. And he had a heck of a time getting to CIRSx. He was flying through Denver like I was. And so he ended up missing Friday as well, or part of Friday as well. And it just seems like he's probably not going to be going to conferences anymore. And so it really was him passing on that torch.
Yeah. Some of the takeaways that I got, aside from the information that he covered, the takeaways that he really seemed to drill home again in that like spirit of passing on the baton. He was very focused on proper screening for CIRS patients and making sure you don't miss anything, miss important information when it comes to the patient's healing. And of course, his focus was on the environment. Step one is the hardest one, getting out of exposure. We know that mold type CIRS, which when I say that, I am including like actinos and endos, that does count for like 80% of CIRS patients and their experiences. So his main goal, I know, for doctors is to cross-examine patients when asking them about their exposure history. And that actually does extend beyond just mold. Like that's any interactions with ticks or spiders or red tide or any of those things, eating bad fish and getting sick the next day, like any weird symptoms that came and then maybe went dormant, maybe they come back every now and then. But his point was to ask exposure questions, history of exposure questions with patients, and ask them again, but like a little different. And a lot of psychological tests are like that. They do ask you basically the same question over and over and over again, but like worded a little different, that you come at it a little different. And we've brought this up before, when somebody is looking at the symptom clusters and they see a word like vertigo, for example, and they're like, oh, I don't have vertigo, because they have this idea in their head of what vertigo is. But they do like get the spins sometimes when they like walk out of an elevator or something like that, which I speak from experience, that happened to me. But like I wouldn't necessarily have said, oh, I had vertigo then. But like, like that's, you want to ask things the different way. Oh, did the room ever kind of spin? Almost like you drank too much, but like you weren't drinking. Like you just want to ask things a different way. And I thought that was a really great thing. Even if you're a patient listening to this and you're not screening for people, this may be helpful for you when you're talking with loved ones who are like, oh, I don't have CIRS, but that's like your mom and they do. Like that's a good way to maybe rephrase some of your questions to get to the truth there, that they don't even know they're hiding it. They don't mean to. They just don't identify the thing the way it needs to be identified.
Another really cool takeaway for me was how many tools he's developed to help with CIRS treatment. And they gave us all red shirts that said publish on the back, because that's his big thing, is he wants people to do research and publish it so that we have more CIRS literature out there. And he was saying that, a patient would come to him and say, I just want to get my brain back. And he would say, well, what if I could show you? And then he brought up the NeuroQuant, and the NeuroQuant being a way that you can measure those volumetric changes in the brain and show someone the before and after and show them getting their brain back. And he has created, with the help of other CIRS practitioners, like just such powerful tools. And you were sharing something you heard in the Proficiency Partner program that Shoemaker mentioned in his talk about blood markers and exposure.
Yeah, so the acronym for it, which I'm sorry to say I don't know what they stand for. I can try to look this up and put it in the show notes, but it's SAIIE. So if you're talking to your CIRS practitioner, you can reference it that way. But your blood markers actually go up in a specific time sequence within days of re-exposure. And the reason this is important is for actually legal reasons, or if you're trying to prove, let's say, an employment office or employment office, your employer, the office where you work is like your is a bad place for you. And you'll want to get led by a practitioner through this process. It involves blood work several times. So they're going to have to be involved and tell you exactly on the timing. But generally speaking, you want to get to baseline health, which is like less than 2 to 3 symptoms. That's what a control, your average Joe on the street is going to have 2 to 3 of the symptom clusters. Whereas, obviously someone with CIRS has 8 boxes out of the 13. So you want to get to baseline health and having stayed out of that exposure spot. And then you want to go into that exposure spot willingly for 8 hours a day. And within about 3 to 4 days of that exposure, you're doing your blood tests according to how the practitioner wants you to. And your markers, your inflammatory markers, will be going up. And you'll have taken, compare your tests from before and after and during. And that's going to show this specific spot is not okay. And that's very helpful and illustrative for, again, if you're dealing with a legal case, very helpful. Or if you're trying to prove to your employer that you cannot come back into work, you want to work from home, or you're going to have to, come up with some kind of accommodation. It's a good way to kind of illustrate that for them. So I thought that was, again, a brilliant tool. And I'm so glad that he figured that out.
And then there was one last thing he said at the end of his talk, because I think he has a reputation of kind of being a hard ass. We've been told this by the providers, and we know that we've been told this by the providers. And at the end, one of his last slides said, sometimes we just have to accept the unknown as enough. Like in his time of CIRS research, he figured out so much. And towards the tail end of that, actinos became a bigger thing. He spent his entire life researching mold, and then it turned out to be actinos being the trigger for many people. And so I think, in his move towards retirement, he's just come to this place where he can accept all of the good work he's done, but then also know there's still more good work to be done by the next generation of providers.
Yeah, that was cool to see given his reputation. I totally agree. But it was powerful talk, really great. So glad that we were able to be there in person for that.
The next talk was Dr. Peg DiTulio and Dr. Christian Navarro-Torres. He's been on our podcast a couple of times, 3 times. I think we counted the other day. He did an episode with us on the neuroquant, one on ADHD, and another one on nicotine. So definitely check out those episodes if any of those topics are interesting to you. Christian is a neuroscientist and he's a researcher. So what he did was he partnered with Dr. Peg to pour through her many years of treating CIRS patients and pulling out some really interesting statistical differences in different symptoms in terms of raising MSH and different treatment methods and raising MSH. So to start, Dr. Peg shared some highlights from the data that Christian later presented. One of them being that histamine is highly underrated in the CIRS treatment protocol. If someone comes in with histamine issues, they're more likely to be treated for histamine issues early on. But their data, I mean, like, spoiler alert, their data showed that patients who received histamine treatment, regardless of whether or not they were presenting with histamine symptoms, had a higher MSH earlier on. So it seems like maybe most of us are having histamine issues that aren't really symptomatic, and treating those histamine issues, whether or not you're symptomatic, can help raise your MSH. She also shared that MARCoNs really matter. Some of the providers say you just have to suppress MARCoNs long enough to raise MSH, and some of the providers say you have to eradicate MARCoNs. And it really does seem like MARCoNs matters when it comes to MSH. So if you want to raise your MSH, which for CIRS patients is a huge goal, and to kind of back up, MSH or melanocyte stimulating hormone is one of the key hormones that's low in CIRS patients, and the downstream effect of which is basically all of our symptoms. So we really want to see that number get higher through our CIRS treatment. So histamine issues, MARCoNs, and then they also showed that the GENIE shows a cascade related to CIRS. So we need to have the histamine stuff, the histamine piece added to the GENIE so that we can identify it and treat it earlier on, and therefore have better MSH outcomes at the end of treatment.
Yeah, and one other thing, and he showed a lot of graphs through a Christian, showed a lot of graphs through his portion of the talk. And one of the other things that they showed was that as MMP9 goes up, MSH also goes down. So treating, if you have histamine, you may need to correct the MMP9 as well to get the MSH up. I do have some lived experience of this. My MMP9 has been going down slowly and my MSH has been coming up slowly. Again, I'm not at optimal levels on either end, but I'm very close. Like my MMP9 is just a little too high to be considered normal, and my MSH was a little too low to be considered normal, which is awesome. So, that's just my own experience kind of reflecting also what they were finding as well. And I know for me, just for what it's worth, my MMP9 seems to be responding really well to the high dose fish oil, and obviously staying out of exposure. That stuff is important too.
Another thing that they showed it's impactful for raising MSH is treating thyroid. So people who are having thyroid issues, thyroid deficiencies, by treating that, they were able to see better MSH outcomes, as well as COVID. They found some interesting stuff with the COVID.
Yeah, that was wild. If you got vaccinated, you started out with lower MSH generally. And when I say you, the patients, I should say, the patients that are in this study. And
you personally.
And if you were never and when they use the word vaccinated, it was, either the first one or like it was all of that. It was like the whole range. Like if you've gotten jabbed at all, but like a lot of people did some boosters too. But if you never got vaccinated, they did not see a plateau in healing in the same way, which that was interesting.
And one thing I forgot to mention at the start of recapping this talk is that all of the stuff we're discussing right now is pre-VIP, which is super exciting because there's some people who believe you can only raise MSH at the VIP step, but they actually showed that MSH can raise, and by treating these things, you can get it to raise faster, more efficiently. So with that COVID study, for example, the plateauing, it may unplateau, like you may continue to have progress at the VIP stage. We just don't have the data for that yet.
One like takeaway also for me is that if you are going through the Shoemaker protocol and you have gotten that far and still things are not being corrected, and I think this is kind of like a nice little hint at where especially Dr. Peg and Christian are going to be focusing on next. One would need to consider co-infections and some other underlying things that also need to be treated. And to their point, histamine is kind of part of that family of like, this is another thing to be treating. And if you do, the Shoemaker protocol can work even better. So that I think I don't want to put words in their mouth, and we'll have them, might have somebody on to talk more about this in the future. But yeah, that's I think a really strong takeaway for anybody listening. Exciting stuff. I love their talk. It's so good to hear them and see them up there. And yeah, I can't wait for what else they're gonna be able to show in the future.
And for the next talk, if everyone could just pause the podcast for a moment and Google Ming Dooley so you can understand why I'm about to say this. She's just the most badass woman I've ever met. She treats CIRS patients. She accumulated all of this research. She's building her own firewall house, like just power woman. Can I be her when I grow up?
She's amazing. I love her too. I didn't really get a chance to even say hi to her until the very, very end after her talk. But of course, I made it a point to thank her for this talk, which finished out the conference. A very fitting finish, I will say, because it was all about published work. But it was just a shame because a lot of people, it's a travel day for them. And depending on what part of the country they need to go back to, a lot of people had to leave and miss it. Big priority for anybody who bought tickets to attend or watch virtually this conference. If you somehow skipped inadvertently Ming Dooley's talk, please go back and watch it. And actually, even if you did see it the first time, watch it again because there's just so much in there that she covers. I mean, she really goes, paper by paper on this. Fantastic summary. I loved it.
Yeah, and for context, so Ming's talk was all about this research she's been doing where she compared all of the Shoemaker literature, so all of the published CIRS research, and compared it to published works about CFS or chronic fatigue syndrome. And it was really interesting because she literally lined up the papers, and with all of the CFS papers, it was like no positive outcome, no positive outcome, no positive outcome, like there were 30 plus papers, just no positive outcome, like maybe some symptom management, but they would find that the effects weren't persistent or consistent between patients, etc., all the way down on all of these studies for chronic fatigue. But then she had the Shoemaker papers and the CIRS papers, and it was like positive outcome, positive outcome, positive outcome on
Symptom
all of these.
resolution, symptom resolution. Yeah, yeah.
And it was incredible to see those compared side by side. But she compiled all of this into her own research paper comparing the published works. And hopefully she finds out soon, it's going to be published in a medical journal that will then be published on PubMed, which is super exciting because then when someone searches for CFS, they're going to see all these papers with no resolution, but then they're also going to see Ming Dooley's work where she's showing resolution for so many patients using the Shoemaker protocol.
I do want to add, just in full transparency, because I found this so compelling that I am actually pursuing this treatment as an extra. Don't worry, guys, I'm still Shoemaker protocol. One of the CFS studies had a one patient situation. So again, it's like, is that a study? But the guy in question did EMDR and that's a type of therapy. It involves rapid eye movement and like thinking about traumatic thoughts, but not necessarily like speaking them out loud. I've actually never done it before, but I've read about it. And I do have an appointment to start that next week for what it's worth. But he did see some improvement within 9 treatments over 4 months. That was a one sliver, and it was some improvement. Again, it was nothing like what you see with the Shoemaker protocol, but it was an interesting one-off anecdotal story within the sea of chronic fatigue. It was the one silver lining of, oh, hey, it was kind of like
That one guy.
one guy. Like, why didn't someone do more of a study? Yeah, well, like seeing that, cool, that's promising, but that doesn't tell me anything really. So I'm now experimenting on myself to see if, and I do have some trauma, PTSD, all that fun stuff. So I feel like I'm a good candidate to try it almost more for that stuff than like CIRS related stuff. But it was just cool enough for me to see that pop up that obviously I remembered it, I wrote it down and I wanted to mention it. But otherwise, what JC described is completely right. Like it was just abysmal the results from those chronic fatigue studies. It was shocking. And it makes you like so sad to think there's so many people who've been diagnosed with chronic fatigue. And like if you look at it, it's CIRS. Like it's not like how are people separating it? Maybe there's someone out there with chronic fatigue and it's not CIRS. I'm not saying that's not true, but like it just probably is. And so if you do have chronic fatigue and you somehow stumbled on this video, please look into the Shoemaker protocol. Give it a try. It's all friggin' 20 years, dozens of research papers have been published on the Shoemaker protocol being effective for what could look like chronic fatigue. It could present as chronic fatigue. That's certainly how my CIRS has presented. So it's just that's what I want. I want the world of chronic fatigue to even know that CIRS exists. That's what I took from that talk.
And one of the haplotypes is actually chronic fatigue. So
Right.
just
Right.
saying.
It's got a name. It's got a name for you guys if you're
They can
interested.
identify that for you.
That's why we do this in our own small way. That's why we're sitting here recording a podcast right now and hoping that it gets to people like that. That's my hope.
And speaking of, the last piece I'll say from Ming's talk is she shared that there was a study done about how long it takes for medical research to be put into clinical practice, and it showed about 17 years. And we're hitting about 20 years of CIRS research now. And so it feels like any day now we're going to hit this tipping point and it's going to become mainstream. And people are going to be able to know about CIRS and access CIRS treatment. And maybe building standards will change and they'll look into our genes to see if they can turn them off so no one has to experience CIRS ever again. We are on the leading edge.
Yeah, that's exciting. I just want more people to know and more people to heal. I'll be happy. It's not a big ask. We can do it, guys.
And in the meantime, for more resources and support on your CIRS journey, you can join us over at theCIRSgroup.com.
We'll see you there.